As a brain doctor, I'm shocked. This sleeping position raises stroke risk overnight. Senior health tips. Every night, millions of seniors lie down thinking they are safe. But a single detail, your sleeping position, could silently raise your risk of stroke while you dream. According to the American Stroke Association, nearly 1 in 4 strokes happen during sleep or right after waking up, catching people completely off guard. And here's the shocking truth. Researchers at Harvard Medical School have now linked certain positions in bed to reduced blood flow in the brain, higher blood pressure spikes, and even dangerous clot formation overnight. Imagine drifting off after a long day, unaware that your body's weight and posture might be pressing on vital blood vessels, slowing circulation, and setting the stage for a catastrophic event by morning. Seniors over 60 are especially vulnerable because of natural changes in arteries, sleep apnea risks, and slower recovery systems. That's why this isn't just a comfort issue. It's a survival issue. In this video, we'll uncover which sleeping positions are surprisingly harmful, how they quietly increase your stroke risk, and what safer alternatives brain doctors recommend. And don't worry, I'll also share practical adjustments anyone can make tonight, without fancy equipment or medications. Stick with me until the end, because the position you choose tonight could literally mean the difference between waking up refreshed or not waking up at all. Number 5. Sleeping flat on your back. Without support. At first glance, lying flat on your back seems harmless, even healthy. Many doctors recommend it for keeping the spine aligned and reducing joint strain. But here's the problem. When seniors over 60 lie completely flat, gravity causes the tongue and soft tissues in the throat to collapse backward, narrowing the airway. This subtle blockage can trigger or worsen sleep apnea, a condition where breathing repeatedly stops during the night. According to the National Institutes of Health, untreated sleep apnea can lead to sudden oxygen drops, spikes in blood pressure, and dangerous stress on brain arteries. Over time, that raises the likelihood of stroke, especially during early morning hours when oxygen deprivation is most severe. Imagine a senior drifting into deep sleep, unaware that every few minutes their body jerks awake for air. Each interruption raises adrenaline levels and disrupts normal heart rhythms. A 2019 study published in Stroke found that seniors with untreated apnea were nearly 3 times more likely to experience a nighttime stroke. The irony is that many people lying flat never realize the risk. They think they're resting peacefully when, in reality, their brain is under constant strain. Better tip: if you prefer sleeping on your back, elevate your head and shoulders with a supportive wedge pillow or an adjustable bed frame. Even a 20 to 30 degree incline can reduce airway collapse, improve oxygen flow, and protect the brain from stress. Seniors who made this small adjustment in clinical trials reported fewer apneic episodes, more restorative sleep, and lower nighttime. Blood pressure. It's a simple change, but one that could save your brain from silent damage. Number 4. Sleeping on your stomach face down. For decades, some people have believed that sleeping on the stomach is the most restful position, especially for those who snore. But for seniors over 60, this position can silently create a cascade of problems that increase stroke risk. When you sleep face down, the neck is forced into an unnatural twist to keep your airway open. This rotation compresses the vertebral arteries, 2 vital blood vessels that run along the spine and supply the brain with oxygen-rich blood. A study published in the Journal of Applied Physiology demonstrated that even moderate neck rotation can reduce blood flow by more than 20%, especially in older adults with stiffened arteries. That means hours of restricted circulation, night after night. But that's not the only danger. Lying on your stomach puts direct pressure on the chest and diaphragm, making it harder for the lungs to expand fully. Reduced lung expansion means lower oxygen levels throughout the night. And for seniors whose cardiovascular system is already more fragile, That oxygen deficit translates into an increased burden on the heart and brain. Add to this the subtle rise in intraocular pressure from face-down positioning, and you get a dangerous cocktail of risks for stroke, heart strain, and even vision problems like glaucoma. Think about this scenario. A senior falls asleep on their stomach and wakes with a stiff neck, slight dizziness, or even numbness in an arm. These are not just age-related annoyances. They can be micro-warnings of compromised blood flow. Researchers from the Mayo Clinic have noted that seniors who regularly sleep face down reported higher rates of morning headaches and transient ischemic attacks, TIAs, often referred to as mini-strokes. Over time, these seemingly minor episodes can snowball into full-scale neurological events. Better tip: if you've been a lifelong stomach sleeper, don't panic. You don't need to force yourself into an uncomfortable new routine overnight. Instead, transition gradually. Start by using a thin pillow under your hips and lower chest to reduce spinal stress, while gently shifting to your side during the night. Specialized body pillows can help train your body to stay in a safer position. Seniors who successfully moved away from stomach sleeping reported fewer morning headaches, steadier balance, and deeper, more refreshing sleep. Remember, comfort should never come at the cost of brain health. Number 3. Sleeping curled on your right side at first glance. Curling up on your right side in a fetal-like position feels protective, even cozy. Many seniors naturally gravitate toward this posture because it eases back pain and creates a sense of comfort. But the truth is, this position hides risks that become more dangerous as we age. When you sleep tightly curled on your right side, the abdominal organs press inward against the inferior vena cava, the large vein responsible for returning blood from the lower body back to the heart. This pressure can reduce venous return, forcing the heart to work harder to keep circulation stable throughout the night. Over time, this additional strain raises the risk of atrial fibrillation, blood clots, and ultimately stroke. Researchers from the European Heart Journal observed that seniors who habitually slept on their right side had a greater incidence of nighttime arrhythmias compared to left side or back sleepers. The mechanics are simple. As circulation slows, blood pools in the extremities, particularly the legs. For seniors who already face varicose veins or a history of clotting, this pooling creates a fertile ground for deep vein thrombosis. And here's the chilling part. Once a clot forms, the curled right side position makes it easier for that clot to travel upward toward the brain if it dislodges. There's also a neurological dimension. Twisting the neck forward and down in a fetal curl subtly narrows the carotid arteries on the right side, making it harder for consistent blood flow to reach the brain. A 2020 study from the Journal of Neurology revealed that seniors who slept in curled right side positions reported higher rates of silent white matter lesions on brain scans, tiny injuries caused by repeated micro-restrictions in blood flow. These lesions accumulate slowly, but they are directly linked to cognitive decline, memory loss, and increased stroke risk. Picture this. An older adult wakes up from what felt like a deep night's sleep, yet they feel groggy, lightheaded, or unusually forgetful. Family members might brush it off as just aging, but these subtle morning symptoms can be warnings that brain oxygen supply was compromised overnight. The tragedy is that many people never connect their curled position with these neurological red flags until a stroke occurs. Better tip: if you find yourself most comfortable on your side, aim to transition toward the left side instead of the right. Left side sleeping has been shown in the Journal of Clinical Gastroenterology to improve circulation, reduce acid reflux, and support healthier blood flow back to the heart. Seniors can make this shift easier by placing a firm pillow behind the back as a gentle barrier, encouraging the body to stay oriented toward the left. A small pillow between the knees can also help keep the spine aligned and prevent curling too tightly. This one adjustment doesn't just protect the brain, it also supports heart health and digestion, making it a win across the board. Number 2. Sleeping sitting up in a recliner or propped in bed. For many seniors, sleeping in a recliner chair or propped upright in bed feels like a practical solution. Arthritis, heartburn, or breathing difficulties often make lying down uncomfortable, so the body finds relief sitting up. But here's the dark side most people never realize. Sleeping in this semi-seated position can set the stage for catastrophic brain events. When the torso is bent at an angle and the legs dangle lower than the heart, blood naturally pools in the lower extremities. Over hours of sleep, this pooling increases the risk of blood clot formation in the veins, a condition called deep vein thrombosis. If even one of those clots dislodges, it can travel upward and block blood supply to the brain, triggering a sudden stroke. Doctors at the Cleveland Clinic warn that extended sleep in recliners creates the perfect storm of immobility, venous stasis, and oxygen fluctuation. There's also the problem of restricted breathing. Recliners and prop beds can pinch the diaphragm, especially if the head is tipped forward. Seniors often nod off in this position without realizing their airway has narrowed, causing shallow breathing throughout the night. Researchers from Johns Hopkins University found that seniors who regularly slept in upright positions experienced significantly higher rates of nocturnal hypoxemia, dangerous drops in blood oxygen. Every episode forces the heart to pump harder, spiking blood pressure and putting intense strain on fragile brain arteries. For older adults already managing hypertension, this combination is like adding fuel to a fire that could ignite at any moment. I once heard a case from a retirement community where a 72-year-old woman, after years of sleeping in her recliner, to ease acid reflux, woke one morning unable to move the left side of her body. She had suffered a severe ischemic stroke during the night. Her doctors explained that long nights in the chair had gradually increased clot formation in her legs, and one night it finally traveled to her brain. Her family thought the recliner was helping her feel better, but in reality, it had become her silent enemy. These stories are heartbreaking because they prove how easy it is for small daily habits to snowball into life-changing consequences. Better tip: if you must sleep in a reclined position for medical reasons, don't do it in a standard chair. Instead, use an adjustable bed that elevates the upper body while still keeping the legs supported at heart level. Compression socks may also help maintain healthy circulation overnight. And above all, take short breaks to stretch and walk during the day to prevent blood pooling. Small lifestyle tweaks can dramatically lower stroke risk, even for those who cannot sleep flat due to reflux or breathing problems. It's about finding comfort without sacrificing circulation and brain health. Number 1. Sleeping curled on your left side with the neck compressed. This might shock you, because left side sleeping is often praised by doctors for helping with digestion and circulation. And it's true, if done gently, left side rest can reduce acid reflux and support the heart. But here's where the danger hides. When seniors curl too tightly on the left side, especially with the chin tucked down toward the chest, they unknowingly compress the carotid artery, the main vessel carrying blood to the brain. Hours of this pressure restrict flow, and in older adults with plaque buildup or arterial stiffness, it becomes a ticking time bomb. Doctors from the American Academy of Neurology have documented cases where seniors woke up with sudden numbness, slurred speech, or vision loss after a night of extreme side curling. These were strokes triggered not by exertion or diet, but by sleep position itself. The problem worsens with age. Seniors over 60 already face natural narrowing of arteries, and curling the body tight on the left side makes the blockage more pronounced. A study in the Journal of Stroke and Cerebrovascular Diseases found that curled left-side sleepers were significantly more likely to develop nocturnal hypertension, dangerous blood pressure surges that occur while the body rests. Each surge puts enormous stress on cerebral blood vessels, making them prone to rupture or clot. And the cruel irony? Because it happens during sleep, seniors never feel it coming. They simply wake up, if they wake up at all, with life-altering damage. There are countless real-life examples that haunt neurologists. One 68-year-old man in Florida, otherwise healthy, went to bed after a normal evening, curled tightly on his left side as he had done for decades. His wife later recalled hearing him make faint choking noises around 3 a.m. By morning, he couldn't move the right side of his body. Doctors confirmed a major ischemic stroke caused by reduced blood flow during the night. His stroke wasn't random. It was tied directly to posture, a risk that could have been prevented. Better tip: the safest approach is moderation. If you favor the left side, avoid curling tightly or tucking the chin to the chest. Keep the neck elongated with a supportive pillow that prevents bending forward. A body pillow along the back can gently limit rolling into extreme positions. And above all, seniors should vary sleep posture through the week, alternating sides, sometimes resting slightly elevated, but never locking into one extreme curl. Flexibility in sleep is protection for the brain. As neurologists say, your arteries need room to breathe. We've just walked through the 5 most common sleeping positions and how each of them, surprisingly, can raise stroke risk overnight. For many seniors, this feels shocking because all our lives we're told that sleep is healing, that sleep restores the body. But as you've seen, how you sleep can quietly turn rest into risk. Whether it's lying flat on your back without support, curling on the right side and restricting circulation, sleeping face down and compressing the neck arteries, propping upright in a recliner that encourages clot formation, or even curling tightly on the left side where the carotid artery is squeezed, each habit creates subtle dangers that build night after night until one morning the damage is irreversible. The truth is, seniors over 60 live with natural changes in the body that make sleep position more critical than ever. Arteries stiffen, blood pressure becomes less stable, sleep apnea becomes more common, and oxygen levels fluctuate more easily. A position that might have felt harmless at 30 or 40 can be devastating after 60. That's why so many strokes occur during the night, or in the early morning hours, just when the body should be at its safest. Scientists from Harvard, Mayo Clinic, and Johns Hopkins have all confirmed this pattern. And yet most people never hear about it until it's too late. But here's the empowering part. Knowledge changes everything. By making small adjustments, like elevating the head slightly when lying on your back, training the body to favor the left side without curling too tightly, or replacing a recliner with an adjustable bed, you take control of your brain's protection while you sleep. These changes don't require medication, surgery, or expensive equipment. They require awareness, consistency, and the courage to break habits that may feel comfortable but aren't safe. Every night is a new chance to protect your circulation, your oxygen levels, and ultimately your independence. I want you to picture this. You wake up tomorrow morning, and instead of feeling groggy, lightheaded, or foggy, you feel truly refreshed. Your brain has been nourished all night with healthy blood flow. Your heart has been spared dangerous surges. Your arteries have been protected instead of strained. This is what's at stake: your clarity, your mobility, your memory, your life. For seniors especially, avoiding stroke is not just about survival. It's about preserving the ability to live fully, to walk, to speak, to share time with loved ones. So here's my final message. Don't dismiss your sleeping position as a small detail. Tonight, when you lie down, remember what we've discussed. Your posture is not just about comfort. It's about brain health, heart protection, and life itself. Adjust where necessary. Protect your body while it rests. And then share this knowledge, because so many seniors are still unaware that their nightly routine could be their greatest hidden risk. Now I want to hear from you. Do you recognize yourself in one of these positions? Have you or someone you love ever experienced strange morning headaches, dizziness, or weakness that might now make sense? Drop your experiences and questions in the comments, because sharing stories could save lives. And if you found this video helpful, don't forget to subscribe, so you'll always know the small, powerful changes that protect seniors after 60. Remember, better sleep isn't just about rest, it's about survival.